Let's talk a little bit about the stools of babies and older children, a topic of keen discussion amongst new parents. So during the first few days of life, a baby passes the first stool, which is called meconium. Now this is very different to all its subsequent stools because meconium is black or dark green, often of marmite consistency, and this can be quite frightening to new parents. Over the next few days, the stools change. Breastfed babies typically have mustard yellow colored stools with little white curdles of milk curdles in them. Formula-fed babies really should have a daily stool, and they should also be a yellow mustard color, but they don't always have the white curdles in them. There's a wide range of what's considered normal in a breastfed baby. So some breastfed babies have 7, 8, 9, even 10 little stools a day. But if they're thriving and happy, that's no problem at all. Some breastfed babies only pass stools once a week, and that's also okay as long as they're relatively comfortable, not too colicky, and not too distressed when they pass that stool, and as long as that stool is of a relatively soft consistency when it comes out. After a few weeks, babies settle into a pattern which, as I said, is widely variable in breastfed babies, but in formula-fed babies should include at least one stool a day for the baby to remain comfortable. Young babies often groan and moan and push when they are passing stools, and this can be a cause for concern with parents. So it's quite obvious when a baby is making a stool. This is nothing to be concerned about. It really is due to the immaturity of the gut, and specifically the immaturity of the anal sphincter, so the anal muscle. It requires quite a little bit of moaning and groaning and pushing to open up the anal muscle in the first few weeks of life. Later down the line, this becomes easier as the baby's gut becomes more mature. Stooling can be a problem if it is so infrequent that it is causing a child discomfort. Constipation is generally defined as infrequent or hard stools, or a combination of both. Generally, a child who is constipated for more than a few days in a row and has lots of pain on passing stools should seek medical attention for some advice. Simple measures for constipation in older children would be increasing their water intake, increasing their fiber intake. In younger babies, we sometimes need a very safe little chip of a glycerine suppository if they haven't passed stools for a few days and are becoming gassy and colicky and uncomfortable as a result of it. Long-term constipation needs to be discussed with your doctor or healthcare practitioner, because such children may need a regular safe laxative by mouth on a daily basis or a few times a week to keep them regular. But most often constipation is physiological. In other words, it's an immaturity of the gut that passes over time. Another time that very typically leads to temporary constipation is when solids are introduced into young babies. Their little guts thus far have only had to deal with easily digested milk, and suddenly a whole magnitude of different foods is thrown at them, so often they become slightly constipated for a few weeks during the introduction of solids, and this is an absolutely normal and self-limiting process. So when do you need to be concerned about stools? We've talked about constipation, so infrequent, hard stools in an uncomfortable baby. We also need to please consult your doctor if there's any blood in the stool or if there's frequent mucus in the stool. Another cause for concern would be watery diarrhea stools that are accompanied by a poor weight gain. So if the child is not absorbing all its nutrients. And lastly, green, frothy mucoid stools could indicate an allergy or lactose intolerance or a lactose overload and should be discussed with your healthcare practitioner.